Morning everybody, Eric Chaconis here for PT on Ice, and today we're talking about proprioception and how really there's a difference between proprioception and balance. Alright, so I'll kind of explain the issues with balance. So actually, Cindy, stand up please real quick. So if typically, face the camera if you don't mind, if you're standing on one leg, right, so typically what we'll do is we'll say, well, we're testing proprioception via balance. Standing on a single leg stance test, right, is certainly a test of muscular strength, joint mobility, the vestibular system. If we close the eyes and occlude vision, then we're using the vestibular system as well. Something like a Y balance test where she's reaching out in the three directions, right? That's certainly a measure of not only strength and balance, it's flexibility, right? There's this reaction time component to the perturbation that needs to be included. So because of that, because of all those reasons, it's really an indirect measure of proprioception, right? That's really the issue there. It's not a direct measure of proprioception, rather an indirect measure that integrates so many other variables, right? So what I want to talk about today is specific tests for proprioception, how you can use these specific tests in the clinic to try to kind of narrow down the actual impairment. So we'll have a seat here. And I have to give credit, all the credit, everything I've learned on this to Nick Clark out of the UK, out of St. Mary's University in London. I met Nick at a conference a couple years ago. He presented on this topic, and since then we've collaborated on quite a few projects. We've got a multi-center study going on right now. And so I've learned a lot from him, and I'll post a bunch of the studies that Nick has published on this topic of joint position sense in the comments section below. So, at Dr. Nick CC. He's on Twitter, at Dr. Nick CC. So check him out. All right, this is called active joint position sense. And what you're trying to do is determine when the patient moves their, in this case the knee, to an angle, can they reproduce that angle, right, when vision is occluded? So do they feel the sensory system of their knee joint? Can they feel the position that they're in space? Can they reproduce that same angle? All right, so you're going to do it a couple different ways because it can be concentric or eccentric depending on the direction you're moving, and that does matter. All right, so what we do is we will have the patient seated. Go ahead and slowly extend your knee. Stop. I tell the patient where to stop. Her eyes are closed, right? Your eyes are closed, Cindy? Okay. So I'll measure that angle right there. 49 degrees, right? So just measuring with my inclinometer, 49 degrees. But don't tell the patient that. You just keep it to yourself. Now bend it back down. Now what I want you to do is reproduce that same angle, all right? So once you extend your knee up again and try to reproduce that same angle. My iPhone orientation got messed up. 46 degrees, 46 degrees. So she was only 3 degrees off. That's pretty good, right? We don't have standard error measurement data on this. We don't have measures of responsiveness, MDC, minimal detectable change, minimal clinical important difference. So really what you're doing is making a side-to-side comparison, right? Comparing the involved to the uninvolved limb. We'll do it again. We'll do it 3 times. So we will go ahead and bring a stop. So I want to try to get a variety of knee angles that she's trying to reproduce. So what I'll do is slowly bring it up and then stop right there. And then, so that is 22. My inclinometer orientation's a little off on this iPhone, but you get the idea, right? So she's at 22. That should really be closer to, what, 70, right? 68. So let's say that's 68. Now bring it back down. You're not telling the patient any of this. They only feel it. They don't actually hear the numbers, right? Now bring it up again. Try to reproduce that same angle. Pretty good. She's only off by 3. That's some good reliability. 3-degree difference again. So the question now is, are they overshooting or undershooting, right? Let's see what you do this time. I can't remember the last. So go bring it up and stop. So that's going to be 54 degrees. Bring it back down. Go again and reproduce that same angle. She overshot that one by 5. All right, so my question is for most of these patients, are they consistently overshooting? Are they consistently undershooting? What is the level of error, right? So you just simply calculate error based on how many degrees off are they, either overshooting or undershooting, and look for consistencies. So a consistent deviation like that, a consistent overshoot, is certainly a proprioceptive joint position sense impairment that you might want to address with rehab. So I can do all sorts of treatment techniques for that, right? I mean, I can have them doing specific little, I'm going to train you, so come on up, stop when you feel my hand, bring it back down, bring it up, stop when you feel my hand, bring it back down. Right? I can do iso holds in that position. Iso holds, getting her aware of where she is. I can have her do tracking exercises where she has to trace a laser pointer and point her toe to where the laser pointer is on the wall and stuff like that. Manual therapy certainly could have a proprioceptive impact. Taping could have a proprioceptive impact. The point is just, when you're assessing proprioception, trying to assess it with a specific method rather than just kind of looking at an indirect method like balance, for instance. There are others. There's force sense. Force sense would be her ability to reproduce the same force, right? So go ahead and push, and now relax. And if I measured that with a dynamometer and got a specific number, and then go ahead and do it again, try to reproduce that same force. And then I want to see, is she able to reproduce the same force, or is she overshooting with too much force consistently, or undershooting with too little force? That would be force sense, which is another nice measure. And we'll do another video on that one here, maybe next week or the week after, and try to dive a little deeper into the topic of force sense. But for now, joint position sense, try that in the clinic. Measure joint angles and see can patients reproduce those same angles when they have vision occluded. All right, take care, everybody.